Hello, everyone. I'm Christelle. I'm a GP from Southampton. I'm also the Greener GP lead for Wessex. And I'd just like to talk to you for 10 minutes about our Beat the Heat heatwave preparedness work here in Southampton. So, I initially started thinking about this properly when somebody from the Climate Action Network locally put together a meeting. And it was a Royal Society of Arts meeting, which is a network of professional change makers. And the topic was Beat the Heat. It was during the hottest part of July in 2024. And it was a conversation about what is needed to prepare for the likelihood of annual heat waves that hasn't been thought about, and how can we come together and meet those challenges. And it was attended by people across the council, the university, emergency planners, businesses, etc. But I was the only person there from health. And so that started me thinking about what is the role of primary care in heat waves and heat wave preparedness. So we've got quite a few challenges facing primary care. So there are patients with specific vulnerabilities during the heat, and those are the usual patients that you might expect, the old, the frail, those with complex medical needs, those with chronic diseases and on multiple medications. There are also others that people don't think of as often. So, for example, people with learning disabilities, dementia, and those with on psychiatric medications. And that's because both dementia and certain psychiatric medications, most of them, in fact, can impair our sense of tolerance and homeostasis and just awareness of whether or not we're hot. And that's a big problem during a heat wave for those people. And most people who are on those medications are not aware of this. Then there's also our population who are vulnerable in terms of their housing, those on lower incomes, those in high rise buildings, perhaps council owned, or perhaps owned by landlords and housing associations, which are very difficult to get hold of and to make infrastructure changes when necessary. And we may be aware of those patients because they may tell us about their vulnerabilities, or we may visit them at home. There's then the challenges to our systems, the increased incidence of heat related illness, not just in terms of the more extremes, such as heat stroke, but also in terms of things like dizziness, low blood pressure, headache, and all the minor things that may well present to us in general practice, or may suddenly mean that a patient's medication is no longer in their best interests for those few days during a heat wave. There's also our own infrastructure design. Many of us work in normal houses, long-term landlords probably haven't upgraded the building for ages, not necessarily got the current energy ratings that would pass for renting out the building to a new client. And we may be very hot ourselves, we may be very hot and bothered, and it may make us feel that we have less tolerance for the increased workload that we have during the heat wave in primary care. So, what resources exist to help us? So, I wanted to highlight these three publications. The WHO have a lot of guidelines for heatwave preparation across the whole of different societies that are quite general. Then the UK Health Security Agents have a specific adverse weather and health plan that includes guidelines for people as to how they can protect themselves in a heat wave. And we can link to that government advice and we can send that to our patients, either all of our patients, or we can pick the most vulnerable in terms of their age or in terms of chronic disease coding, and we can send them those messages. It includes advice such as staying indoors, especially during the hottest part of the day, keeping well hydrated, and ensuring that they stock up on their medicines and know which of their medicines may render them more vulnerable. In terms of which those medicines are, that's also detailed here in this publication by the Society for Acute Medicine. And it also talks about measures that hospitals and healthcare facilities can put in place to protect staff during heat waves, like looking at temperatures, looking at working practices, ensuring adequate rest breaks, ensuring people can wear appropriate clothing during their work shift, and also identifying the patients that might be most vulnerable, as well as being aware of the normal presentation for heat-related illness. But what can we do as practices or as ICBs or as green and GP leads to get these messages out and to get people thinking about heat waves well enough in advance? So we can hold education sessions for clinicians on heat and health challenges, presentation of heat-related illness, and how to get the messaging out to patients that they might be vulnerable in a heat wave. We can educate patients using consultation models such as chronic disease checks and medication reviews in particular to highlight that they might be particularly vulnerable during a heat wave. And we can do that all year round. It doesn't just have to be during a heat wave. We can sign up for heat wave alerts from the Met Office to be sent directly to our practice so that we know when a level 3 or 4 heat wave is coming, and we can send that information by MJOG or other software to our patients, signposting the NHS deliverable advice. We can also involve allied services. So as GPs, we might have a lot to fit in during medication reviews, but there are some practices who employ pharmacists to do medication reviews. And that's an opportunity for a pharmacist to develop a tick box that they've discussed heat wave vulnerability if a patient is on one or more medication on that list of medications that render people vulnerable, which is in that former document. And the slides will be shared at the end of the presentation so that you can reference that. There's also other opportunities with allied health professionals that I've identified. So, for example, community independence teams that go in after falls, they often do a thorough review of a patient's home. They could be including things like whether or not that particular patient is vulnerable either to extreme cold or to extreme heat, and linking them with local services such as charities that might be able to advise them on home insulation and also things like staying well, staying cool, staying out of conservatories during heat wave if it's their normal habit to go into a conservatory, etc. There's also fire services that do safe and well checks. They mainly concentrate on things like clutter and whether or not a patient might be vulnerable to hoarding and therefore fire risk. But they could also be including risk of vulnerability to extreme weather in their checks. These are very new ideas, and I'm not aware of anybody that is including these things in those services, but it's what we've identified potential in, and I'm trying to have those conversations with the local ICB leads. I think there's also a role for us as healthcare professionals and as advocates to join in a wider conversation. So we probably have expertise that can feed into public health conversations around heatwave preparedness. Who's the most vulnerable? How do we get the messaging across to them, etc.? Because a lot of that is things that will be thought about by public health teams as well. Emergency planning teams are usually embedded within the council and potentially also within our ICBs. There's not much thinking about heat waves at the moment because they tend to be reactive rather than proactive about the risk of them. There's also local hospital sustainability teams, which may be doing their own work around heatwave preparedness, and we can feed into that wider conversation with them. There's also the wider conversation about public awareness that heat waves aren't just an isolated problem, they're growing year on year. And I don't think people understand about the climate emergency. We have got a resource now, which is the People's Emergency Briefing. And there are screenings of that currently showing around the UK. We can encourage our wider health teams to attend those screenings. For example, public health leads and ICB leads, we could encourage them to attend one of those screenings, which does include a very short briefing from Professor Hugh Montgomery from the UK Health Alliance for Climate Change on climate and health risks. There's also, for those who have capacity, opportunities with community initiatives, grant applications, etc., for raising awareness, looking at green infrastructure in particularly vulnerable neighbourhoods, which are often mapped. They are in our city there. They've mapped those vulnerable to urban heat islands. And a grant has been obtained for engaging with children in green spaces and engaging citizens with what green infrastructure is needed in their area to provide shade. Some charitable organisations and councils are looking at community cool spaces similar to the winter warm spaces, where they will provide air conditioning and ice cold drinks for people. There's also a link with charities providing home insulation advice that are also now looking at how that can be coupled with home cooling, because some of the initiatives that make homes well insulated are also those that make homes cooler, such as appropriate blackout blinds and appropriate wall cavity insulation, etc. And we can link people and signpost through our social prescribers with those initiatives, even if we're not involved in them ourselves. And there might also be a role to engage green infrastructure planning teams at the council and ensure they've got a public health and a health lens when they're looking at that green infrastructure planning and looking at who's most vulnerable to urban heat and also potentially poor housing. So that was just a very brief overview. And just to say that I've got no interest to declare, when I'm not doing general practice, I volunteer for an urban nature connection charity, which is how I've been involved in these wider conversations about green infrastructure. And any questions or thoughts, we'd love to hear from you at Greener Practice. One of the conversations that we've had is, how do we go about things like sick day rules for patients who are particularly vulnerable? And at the moment, there isn't a blueprint for that, but we think that there's a role for having individualized conversations with patients when they do present with heat-related illness. And it might be that we say to them, next time there's a heat wave, don't take this medication because this happened to you during this heat wave, etc. And then we make very personalized plans for them, either when we see them with heat-related illness or subsequently in medication reviews. But at the moment, there aren't any very specific sick day rules. It's up to us to provide that patient with an individualized plan, ideally in advance of a heat wave, before they present with heat-related illness. So I hope that's given you some of the ideas to think about, and I hope you stay cool.